Many students struggle on the Med-Surg neuro exam because they focus their study time on cellular theory and biochemical pathways. While these details are important for understanding a disease, the exam prioritizes a different skill: identifying immediate threats to patient safety. Take Parkinson's disease. A textbook might focus on the precise loss of dopamine-producing neurons within the substantia nigra of the midbrain. In multiple sclerosis, the academic focus is often on the immune system's destruction of the myelin sheath, the lipid substance that insulates the axon. This level of detail is necessary for pathology, but a Med-Surg exam question is built to test your clinical judgment. It asks if you can recognize the moment a patient becomes unsafe and take the correct action to protect them. An expert nurse views these conditions through a lens of risk. They look past the medical label to identify the specific physical threat that requires an immediate intervention. When a patient's mobility is compromised, the risk of a fall becomes a primary concern. A physical injury from an unassisted fall can create a secondary emergency that complicates every other aspect of the patient's treatment. This risk presents differently across neuro conditions. In Parkinson's, a rigid, shuffling gait; in multiple sclerosis, extreme muscle weakness; and in dementia, confused wandering. Because the risk of injury is the same across these diagnoses, the nursing actions are standardized. You clear the environment of hazards, assist with all ambulation, and keep the bed low. The second major risk to manage is aspiration. When a patient loses the ability to protect their airway, they face the immediate danger of respiratory distress or pneumonia. The cause of this risk varies. A Parkinson's patient may have physically weakened swallowing mechanics, while a patient with dementia might simply forget the process of swallowing. To mitigate this threat, nurses prioritize safety during intake, positioning the patient strictly upright and performing slow, thorough feeding assessments. Organizing your care by these physical risks ensures that you address the most immediate threats to the patient's physiological stability first. The third major risk we face is confusion. In a neuro setting, the specific nature of a patient's confusion dictates whether your response is routine monitoring or an emergency assessment. Dementia involves a slow, progressive decline in cognitive function over years. Management focuses on providing a stable environment, supervision, and consistent reorientation. This is distinct from delirium, an acute state of confusion developing rapidly over hours or days. Urgent delirium requires an immediate search for a physiological cause. The nurse must check for underlying issues like hypoxia, infection, or medication toxicity. The final risk to manage is fatigue. Though subtle, extreme physical exhaustion can destabilize a patient and worsen all other neurological symptoms. This is a critical factor in multiple sclerosis. High levels of fatigue combined with temperature sensitivity can trigger a relapse, causing a sudden worsening of the patient's condition. Managing this risk involves clustering nursing care to allow for periods of rest and strictly avoiding environmental factors that lead to overheating. Securing cognitive clarity and preserving energy reserves is a critical component of neurocare. Without these safeguards, the patient is at a higher risk for relapses and secondary complications that derail recovery. Consider an exam scenario where a patient with Parkinson's disease begins to cough while eating dinner. A novice student might focus on the diagnosis of Parkinson's and look for answer choices related to dopamine levels or medication timing. This diagram shows the mental shift required for the exam. The nurse strips away the medical label and sees the cough for what it is: an immediate threat to the airway. Once the risk is identified, the correct intervention becomes clear. In this case, the nurse must immediately sit the patient upright to prevent aspiration. Success in Med-Surg comes from moving beyond the memorization of disease mechanics and developing the ability to identify and neutralize the most immediate threats to your patient's life.